continued endeavor to bring world-class advanced therapies close to the patient we serve. Thank you to Mr. Colonel Madhusudan and his family who trusted in us and have successfully completed this therapy with us. This achievement has been made possible through the dedication and collaboration of our multidisciplinary team, which you can see all the way down here, for whose expertise and commitment continue to redefine standards of patient care. We are honored to have you all with us and we share this important journey, and we hope today's interaction will provide valuable insight into the breakthrough therapy and our vision for the future of cancer care. Thank you once again for your presence, and I wish you all a very informative and engaging session. Thank you.
This was going on. Doctor is asking us that this procedure will help us to use some very extraordinary result for a patient who is having such problems. So there were some discussions happening in between and some hiccups, but the insistence of Dr. Arun, Dr. Balaji, Dr. all these things happened late in the evening. I was here on that day of that. When this approach was to be done. Last 8 o'clock in the night, all these things were done. Next day morning, we were taken this. I'm very happy that the patient who has taken this treatment is doing very well. And I congratulate the doctors who has taken this initiative to extend the best care opportunities to the patients. So thank you all again, and my best wishes to all. Thank you.
Clinical lead and senior consultant, medical oncology, Gleneagles Hospital Chennai. As everybody mentioned, here we have today with our patient, we have come with the successful results for this patient. The key insights about this situation is the primary CNS lymphoma, what the patient has already got diagnosed with. It's a very toughest tumor and very rare tumor. Cure is a remote one for them. Cure is certainly not possible. It's not a tumor, it responds very well for the chemotherapy and other treatment. Here we considered all the standard of care treatment like chemotherapy and radiation therapy upfront, but in spite of that patient progressed and we were in a desperate situation. And that time we were discussing with the newer treatment options available across the world, and we discussed these options with the patient attender. Patient attender were very much convinced with the newer treatment modality. With our entire team, we formulated the plan and then we asked for the permission to proceed. After getting consent from the patient, with all the support from the entire team, with a lot of challenges happening in the due course of treatment, and after facing those challenges successfully with all the support from my team, today I have brought the patient with complete response to the therapy. Now he is almost cured. We are shortly publishing these case reports in scientific journals, whereas reputed international journals, because even in international wide, this treatment has not proven to be very successful one. Here and there, some anecdotal reports I have seen, but otherwise, this is an eye-opening, a light in the tunnel. Like it's a newer treatment which is going to give a promising future for all these rare case situations. Any questions from your side? Otherwise,
for Arun sir and his team and hospital management for treating my father this case. So initially, we don't know what this is exactly. So we are from Andhra. So his brother is working here. And Dr. Rajnikant we know. So initially, when we came here, so we don't know anything so we talked to them and initially we thought it was a neuro-related thing. So after that biopsy we got to know these things. So Rajnikant sir and so during that part of journey, Dr. Gleneagles sir and Srinivasan sir, Panikiran sir, so they all referred to Dr. Arun sir. So Arun sir and his team, so they have taken care of my father very well. So at each and every stage, I feel so we are losing hope. So they were pushing me very hard. So even my uncle, Dr. Vamshi from UK, so he also gave some suggestions so in India, doctors, so I believe Dr. Arun sir, I aim for my life for him. So he and his team, so during this cardiac the whole 3 months, they have done very hard work day and night, even 1 o'clock, 2 o'clock. So they were picking my calls and treating my father very effectively, so whenever needed. So they have taken care of him very well. So because of that, today he is alive. Thanks for hospital and treating him.
Arun sir, patient. Arun sir, Ajay sir, ముందు పదే కష్టంగా ఉంది సార్ ఇంట్లో నడవగలుగుతున్నాను నడిచేది
1 month already.
2 months ఇంటికి
your son is here, you are happy right now. Now your person is very
నా పేరు